Hi everyone, my name is Shirley and I am currently a pharmacy student here at Buffalo Psychiatric Center. Today I will be discussing two types of respiratory diseases, asthma and chronic obstructive pulmonary disease or COPD. These are the objectives for today's topic. We will talk about what asthma and COPD are and how they differ, how they are prevented and treated. Later on, I will review what proper inhaler technique is and why it is important. And then in the end, I will review some key takeaways and then wrap it up with some questions and a fun activity. First, let's talk about asthma. Asthma is a chronic disease that people live with every day long term. It affects the airways of their lungs, which is supposed to provide oxygen for their body to create energy. People with asthma have extra sensitive airways, so they will experience symptoms like difficulty breathing when they're exposed to certain triggers because of the inflammation and muscle tightening that is happening in their airways. And we will see how this works in an animated video from the American Lung Association.
Asthma is a chronic lung disease that can cause breathing problems throughout someone's lifetime. When you have asthma, there is always a little swelling or inflammation inside the airways, with or without symptoms. Your lungs react to things that may not bother other people. These are known as triggers. Asthma can cause changes within the airway, all of which narrow the opening, making it difficult to breathe. A healthy airway is clear with no interior swelling, and the muscle bands around the airways are not tight. There is no extra mucus. Air moves freely through the open airway. When you have asthma, three main changes can happen in your lungs. If your asthma is left untreated or poorly controlled, changes to the structure of the airway may be permanent. One is swelling or inflammation. This is when the airway becomes swollen and irritated. When the airway becomes inflamed, it narrows, and it is hard for air to flow through. Another change that can occur with asthma is extra mucus production, which clogs the airway, making the opening even smaller. The third change that can happen with asthma is the tightening of the muscles that surround your airways, called bronchoconstriction. This reduces the opening even more. When someone with asthma comes in contact with an asthma trigger, such as dust, tobacco smoke, or even when laughing, any one or all three of the airway changes can happen. This is known as an asthma attack, or episode. All of these changes contribute to the narrowing of the airways, making it hard to breathe.
Asthma symptoms can range from mild to severe, and they can also change in how they happen, how often they happen, and how severe they are. And each person will have different triggers that can make their symptoms worse. And when symptoms worsen suddenly, this is called an asthma attack. The most common symptoms include wheezing, which is a whistling sound when you breathe out, chest tightness, coughing that is persistent and dry, especially at night, and then difficulty breathing or shortness of breath, even when you're resting. Common asthma triggers include indoor allergens like dust, mold, pet dander, and fur, outdoor allergens like pollen and mold, emotional stress like feelings of intense anger, anxiety, crying, or laughing, physical activity or exercise, especially in cold and dry climates, infections or illnesses from colds, influenza, or COVID-19, and certain medications like over-the-counter pain relievers, especially aspirin, ibuprofen, or naproxen, and certain blood pressure and heart medications like ACE inhibitors and beta blockers. And air quality that is high in pollution can also trigger symptoms. Potential complications can happen if asthma symptoms are not controlled or treated. These include feeling tired all the time, having difficulty at work or school because you're not able to perform at your best or have to be absent, developing stress, anxiety, or depression, having disruptions in your work and free time because of unplanned visits to the doctor's office or hospital, developing infections like pneumonia, and you also have an increased risk of experiencing a severe asthma attack or flare-up that can be life-threatening. The exact cause of asthma is not known. We do know that it starts during childhood when the immune system is developing, so we may consider causes like environment, viral infections, genetics, and family history. Some potential steps you may take to prevent development of asthma is controlling the dampness in your home and preventing mold, avoiding air pollution, and maintaining a healthy weight. You should also be aware that there is no cure for asthma. In the next few slides, we'll talk about COPD. Chronic obstructive pulmonary disease, or COPD, is a term used to describe a group of diseases that causes a restriction in airflow and breathing-related problems due to a blockage. These include emphysema and chronic bronchitis, which you will see how this works out in an animated video from the American Lung Association.
COPD is used as a blanket term for two subcategories of lung disease. If you've been diagnosed with emphysema, you have COPD. If you were diagnosed with chronic bronchitis, you have COPD. You can also have both emphysema and chronic bronchitis, and you guessed it, that means you've been diagnosed with COPD. There are important differences between emphysema and chronic bronchitis that are worth noting because they can help inform your treatment options. First, let's look at our lungs and how they function. Our lungs are an organ that is used to exchange oxygen from the outside and release carbon dioxide from the inside. They have a very important job. They provide the vital organs with oxygen. When our lungs get injured, especially from smoking, we end up seeing them develop different types of injuries from chronic inflammation. Chronic bronchitis is a disease of the large airways, where excess amounts of mucus are produced. This mucus can cause blockages of the airways that can be coughed up by the patient with chronic bronchitis to improve their breathing. The coughing is a result of injury to the airways themselves. Emphysema is different because the airways may be injured, but it's a function of smaller airways. The lungs are a connection in a network of big to small tubes with air sacs connecting them. When those smaller tubes within the airways get injured, those air sacs get damaged. As a result, there's loss of elasticity of the lungs because the lungs are really just a big rubber band that expand and contract. With emphysema, there's air trapped in the lungs that our bodies cannot push out, and as a result, it's harder to breathe. While there's no cure for COPD, treatment is available to help relieve symptoms you may be experiencing. Talk to your healthcare provider about treatment options.
The common COPD symptoms include frequent coughing or wheezing, which is often the first symptom people have, and you may hear this referred to as a smoker's cough. There's trouble taking in a deep breath because of the chest tightness, and there's extra mucus that is produced that may be thicker or different in color, like green or brown, and people will experience difficulty breathing or shortness of breath. And these symptoms can range from mild to severe depending on the person, and certain triggers will worsen those symptoms. You should be aware that the damage done to your lungs over time is not reversible, and this can cause you to experience more serious symptoms, which will worsen your COPD. And when symptoms worsen suddenly, that is called a COPD exacerbation or flare-up. Each person with COPD may have different triggers that set off or worsen their symptoms, so reducing and avoiding those triggers are important to prevent symptoms from happening. The most common COPD triggers include smoke from cigarettes, electronic cigarettes, or secondhand smoking, strong odors, dust, chemicals, and fumes from the workplace or products like perfume, hairspray, cleaning supplies, and candles, bad air quality, especially with cold, windy, or humid weather, pollen and air pollution, and respiratory or lung illnesses from infections like cold, flu, or sinuses can cause symptoms to onset. These potential complications can happen if COPD symptoms are not controlled or treated. This includes having activity limitations like difficulty walking long distances or climbing up the stairs, needing special equipment like portable oxygen tanks, which can be a burden to carry, developing increased confusion or memory loss because of decreased oxygen over time, being absent from work or losing free time because of unexpected emergency room visits and overnight hospital stays, or being at a higher risk for other health problems like lung infections, heart disease, lung cancer, and weaker muscles and bones. And in this case, COPD exacerbations or flare-ups can become very serious and be life-threatening. Unlike asthma, we know what potentially causes COPD. This includes long-term exposures to irritants like smoking cigarettes or secondhand smoke, exposures to chemicals, dust, and fumes in the workplace, and exposures to air pollution from motor vehicles, factories, or power plants. Genetics can be another cause if someone were to inherit a condition. And out of all these potential causes, smoking is our biggest concern because it is the most preventable cause. So there are some steps you can take to prevent the development of COPD, and that includes quitting smoking, avoiding secondhand smoke exposure, staying up to date on your vaccinations, especially the ones that fight against respiratory viruses, and using protective equipment and following safety trainings for workplaces. You should also be aware that there is no cure for COPD. Now we will talk about how we can treat asthma and COPD. The overall goal when managing asthma and COPD is to improve the affected person's functional status and quality of life. This is so they can enjoy everyday activities without experiencing the breathing-related problems that we have discussed. This goal can be reached by keeping symptoms under control, and this is a big factor because worsening symptoms will worsen the disease and eventually cause a flare-up down the line. And we also want to prevent flare-ups like asthma attacks and COPD exacerbations from happening in the first place and from happening repeatedly. Any complications should also be managed quickly because they can become life-threatening. And preserving the best lung function is important to decrease the amount and severity of symptoms and to slow down development of severe forms of either disease down the line. Moving on to lifestyle changes, we will talk about the non-medication options available. The recommended lifestyle changes for asthma are based on what is triggering that person's symptoms. For example, if you are a smoker, it's important to have continuous discussions with a healthcare professional, like a pharmacist. They can provide guidance and support you to quit smoking. You should also avoid smoking in homes and cars. If you experience symptoms with physical activity, it may help to warm up before exercising by stretching or taking a brief walk, and doing breathing exercises through meditation or yoga. It's very important to avoid your triggers, especially certain medications like over-the-counter pain relievers. There's aspirin, ibuprofen or Motrin, naproxen or Aleve, and even heart and blood pressure medications like beta blockers and ACE inhibitors. If you have dampness in your home, you want to try to use a dehumidifier, and if there is mold, you may consider hiring a professional to get rid of it. The recommended lifestyle changes for COPD can be different depending on what is triggering that person's symptoms. If you are a current smoker, you may want to discuss with a healthcare provider how you can quit smoking. Lung rehab is an individualized therapy program for people with really severe COPD who need extra support to manage their symptoms and medications. Long-term oxygen therapy is an oxygen tank that people will have to carry around with them that will provide the additional oxygen support they need to make energy for daily functioning. Certain vaccines are important for people with COPD because they can safely and effectively prevent certain respiratory diseases or lessen the severity of the disease when you're affected by it. It's important for people with asthma and COPD to get vaccinated because they have an increased risk of developing viruses and diseases because of the weaker immune systems. These 6 vaccines that are recommended include the flu vaccine, COVID-19, pertussis or whooping cough, the pneumococcal vaccine or vaccines for pneumonia and meningitis, shingles, and RSV. Let's talk about how asthma is treated. Everyone with asthma should always be treated with a controller and a reliever. The controller is a medication that is used as a maintenance for asthma, so it targets symptom control and future risk for asthma. This is intended to be used continuously, meaning every day, even if you are not actively having asthma symptoms. The reliever is also known as a rescue inhaler, and this is used as needed in addition to the controller for quick symptom relief. And depending on each individual's needs, there may be other therapies and medications that are added on. Let's talk about how COPD is treated. After you are first diagnosed and assessed for COPD, doctors will then use this guide to decide which types of medications you will need to manage your symptoms. There is typically a long-acting inhaler on board for maintenance and a short-acting inhaler added on for quick relief. You should be aware that the more severe your COPD is, the more types of medications you will have on board to manage it at its best. Now we'll talk about the types of medications that we use to treat asthma and COPD. First, we'll talk about different types of inhaler medications, which will be our main focus for today because they make up the majority of asthma and COPD treatment. And there will be 5 different types that we will talk about. Beta-2 agonists are a type of inhaler that help open the airways by working to relax the smooth muscles in your lungs, and this will allow air to flow through for better breathing. You should be aware that beta-2 agonists do not work on inflammation and only help with the muscle tightening. Short-acting beta-2 agonists, or SABAs, are asthma and COPD treatments that are used as reliever inhalers, and they are as needed for quick relief because they work within 5 to 10 minutes. Albuterol is our most common example under the brand names ProAir, Proventil, or Ventolin. Levalbuterol is another option under the brand name Zofran. These side effects are greater with the more doses that you are taking. It can cause shakiness, increased heart rate, a feeling of heart pounding, lightheadedness, low potassium, high blood sugar, and even tachyphylaxis. And tachyphylaxis is when the medication slowly stops working for you over time because of repetitive use. So fun fact for SABAs, using it too much or repeating it can really cause tachyphylaxis. These are the long-acting beta-2 agonists or LABA inhalers. There are medications that will treat asthma only, COPD only, and ones that will treat both. So for asthma, there is formoterol and vilanterol, and those are only available in combination with other medications. And there are 4 medications that are for COPD only, and that is formoterol or Perforomist, olodaterol or Striverdi Respimat, aformoterol or Brovana, and indicaterol or Arcapta Neohaler. Salmeterol or Servant is a medication that can be used for both asthma and COPD. LABAs are controller inhalers that are used for daily maintenance, even when you're not experiencing symptoms, so that you can prevent symptoms in the future. They are called long-acting because they work in the body for at least 12 hours, and the potential side effects are the same as what I mentioned for SABAs. And you should know that LABAs can only be used alone for COPD treatment. Next up, we will talk about inhaled corticosteroids, which are also known as ICS. This is a very important medication that helps decrease the inflammation part of asthma, especially if your asthma is persistent. And because this decreases the inflammation or swelling in the airway long term, it will decrease how overreactive and sensitive your airways are to triggers. We have 6 ICS inhalers, or inhaled corticosteroids, that are available. They include cyclosinide, or Alvesco, fluticasone propionate, or Flovent and Advair, fluticasone furoate, or our annuity Ellipta, beclomethasone, or Qvar, mometasone, or Asmanex, and budesonide, or Pulmicort. Inhaled corticosteroids, or ICS inhalers, can cause several side effects. The most common is oropharyngeal candidiasis, or oral thrush, which happens in 30% of people who use this. And this is a fungal infection that affects the lining of your mouth and creates these white patches. But this can actually be prevented by rinsing your mouth and spitting it out after you use your inhaler. Other side effects include a hoarse voice, high blood sugar, and a risk of bone fracture. Muscarinic antagonists work to open the airways by blocking the smooth muscles from tightening, which will prevent the airway from narrowing and getting smaller. Short-acting muscarinic antagonists, which we call SAMAs, are a medication type that we only use in COPD, and there is only one medication that is available, and that is ipratropium bromide. The brand name is Atrovent. This medication can cause those anticholinergic side effects that we talked about earlier, and the most common is dry mouth. Some other information you should be aware of is that SAMAs are controller inhalers that are used for daily maintenance, and they actually have a longer duration than SABAs. These are the long-acting muscarinic antagonists, also known as LAMAs. Tiotropium or Spiriva is an option that can treat asthma and COPD. Most of the LAMAs will treat COPD, and they include aclidinium or Tudorza Pressair, meclidinium or Incruse ellipta, glycopyrrolate or Seebri Neohaler, and revefenacin or Uprelvy. LAMAs are a controller inhaler that are used for daily maintenance to prevent future symptoms, and they work for over 24 hours. These side effects are generally the same as the SAMAs we talked about. In particular, for tiotropium, it can cause a metallic taste in your mouth. You should also know that tiotropium or Spiriva can treat both asthma and COPD. Next, we will talk about the types of combination inhalers available. Most of these will be for COPD treatment. ICS and LABA combination products are used to treat both asthma and COPD, and this includes a long-acting beta-2 agonist and an inhaled corticosteroid, so they will work in 2 different ways to open up the airways. These are the ICS and LABA combination inhalers that we have. The most important is budesonide with formoterol, also known as Symbicort, and we also have other options under the brand names Advair Discus, Brio Ellipta, and Dulera. ICS and LABA combination inhalers are mostly used for control for daily maintenance. There is an exception with Symbicort where that one can be used as a reliever and a controller, so it can mean that you have one inhaler that can cover both parts of asthma treatment. And for the side effects, they include both the ones I listed for LABAs and for ICS inhalers alone. Here are some pictures of the brand names of the ICS-LABA combinations that are available. We have Symbicort here on the upper left, and then on the bottom we have Brio Ellipta. There's also Advair Discus, and then Dulera is an option too. The SABA and SAMA combination inhalers are products that are only used for COPD, and this combination is more effective than either of the medications alone. The medication shows greater and more sustained improvement in the amount of air a person can force out of their lungs, which ultimately means that they are improving their COPD. SABA and SAMA inhalers can be used in COPD for reliever or controller purposes, and there is only one product available, which is albuterol with ipratropium, and the brand names are Combivent Respimat and Duonev. The side effects are the same as what I mentioned for SABAs and SAMAs earlier, with one exception. So people taking this combination inhaler did not experience tachyphylaxis over 90 days of treatment, which was a problem we experienced with SABA inhalers. So that means that people with COPD who are using this inhaler will not experience a decrease in response to the medication over time with repeated use. LABA and LAMA combination inhalers are also only used to treat COPD, and they are dual therapy products that work in two different ways to open up the airways. LABA and LAMA combination products are controller inhalers, and they are used for daily maintenance in COPD. There are 5 combination products available, and they are under the brand names Udibron Neohaler, Stiolto Respimat, Anoro Ellipta, Bevespi Aerospare, and Duoclear Pressair. There are no changes for the potential side effects. They are the same as what I mentioned before for each of the medications, the LABAs and the LAMAs. You should also know that when these two medications are combined, they work better to prevent exacerbations or flare-up of your COPD. The last COPD inhaler that we will talk about is a triple therapy product that is only used for severe COPD treatment. And the 3 medications that are included in this triple therapy will be an ICS, a LAMA, and a LABA. So if we think about what we learned earlier, this makes sense because the more severe your COPD is, the more types of medications you may need to take. Triple therapy products are used as controller inhalers for daily maintenance of severe COPD, and there are only 2, and they are available under the brand name only, and that includes Trelegy Ellipta and Breztri Aerosphere. And because they are available as brand name only, they're often very expensive or not covered by insurance companies. There is no change with the side effects, and any potential side effects include the ones that I mentioned for ICS, LAMAs, and LABAs. Although this inhaler works great to treat severe COPD, you should also know that this can increase your risk of pneumonia because of the inhaled corticosteroid component. And this is because steroids can suppress your immune system, which will decrease your body's ability to fight off infections and diseases. These next few slides will be for your information only. I will talk about the oral and injectable medications available for asthma and COPD treatment. These are the oral and injectable medications available for asthma and COPD. We have the asthma-only treatments on the left, which are the biologics, leukotriene receptor antagonists, or LTRAs, cromolyn, and epinephrine. And then for COPD only, there are PDE4 inhibitors. And then for both theophylline and systemic steroids are a choice. Biologics are injection medications that are not commonly used to treat asthma because they are for people with specific types of asthma and very severe asthma, and they will have to be diagnosed by medical doctors that are allergy or asthma specialists. Additionally, these types of medications are usually only available through specialty pharmacies. These are the 5 biologic medications that we have available, and you can tell that they are biologics because they will end in MAB, MAB, and they can be very complex, which is why asthma and allergy specialists are the ones who manage people who take them. So what I want you to take away from this information is that most of these biologics are administered in the healthcare setting, like a doctor's office or clinic, because there's a high risk of anaphylaxis, which is a severe life-threatening allergic reaction. And there is only one biologic that you can administer by yourself at home. Leukotriene receptor antagonists, or LTRAs, are oral medications that are used to block certain natural chemicals in your body that would usually cause inflammation. This is unique because we usually think of steroid medications like ICS inhalers as the only type of medication that can reduce inflammation, but LTRAs can do this without being a steroid medication. There are 3 leukotriene receptor antagonists, or LTRAs, and they are montelukast, or Singulair, zafrlukast, or Accolate, and Xyluton, or Zyflo. LTRAs are not commonly used because of the severe side effects they cause. The most common include headache, and then neuropsychiatric changes for montelukast, liver failure for zafrlukast, and liver toxicity for Xyluton. You should also know that montelukast, or Singulair, can be used for allergies too. Theophylline is another medication that is not commonly used to treat asthma because even though it widens the airways to help people with asthma breathe better, it does that by releasing epinephrine to the whole body. So this can cause unintentional side effects to everywhere else in the body, and that can be very serious. Interestingly, when theophylline breaks down in the body, it unintentionally creates caffeine here that is active and will affect the whole body. So with the understanding that theophylline breaks down into epinephrine and caffeine, it will create extra adrenaline and energy, which will cause many parts of the body to become hyperactive. This increased activity all over the body will lead to many bad side effects, which is a big reason why we don't use this medication for asthma treatment. Some of these side effects include loose stools, an increased heart rate, insomnia, tremor, nervousness, nausea, and it can also cause toxicity. Inhaled cromolyn or gastrocrom is not recommended for regular use because it does not work to relieve or prevent future asthma symptoms. Inhaled epinephrine is available over the counter under the brand name Asthmanephrine, and this one should be avoided at all costs because of the side effects it can cause. Systemic corticosteroids are medications that are taken by mouth, and examples include prednisone and methylprednisolone or Medrol dose pack. These medications are not recommended to treat asthma or COPD because they do not work better than ICS inhalers or our inhaled corticosteroids, and they also cause way more side effects than ICS inhalers. Phosphodiesterase 4 inhibitors are an oral medication that are used in COPD only to reduce inflammation. Roflumilast or Daliresp is the only PDE4 inhibitor used for COPD for daily maintenance, and this is taken by mouth. This is not commonly used because of all of these major side effects that we see here. How do you use inhalers properly? Now that we have an understanding of what inhaler medications are used for, I will go over what the proper techniques are to use them correctly. If you have asthma or COPD, it's very important for you to know how to self-administer the medications that come from the inhaler devices. This is because you want to make sure that the medication is being inhaled deeply enough all the way through the airways and down to the air sacs. In addition, each inhaler product that we've learned about come in several different devices that can administer that medication. This means that they each have their own set of instructions to follow in the packaging so that you can use them correctly. You should also know that if you're experiencing trouble using the inhaler or you're unsure of the correct technique, you can check with your healthcare provider like a pharmacist who can answer questions and help identify the reason you are having trouble, or they can demonstrate how you can use the inhaler correctly in person. The first inhaler technique video that we will watch are for metered dose inhalers, or MDIs, and these are pressurized devices that hold the medication in a liquid form and will create an aerosol spray when used. The most common MDI that people use in asthma and COPD is albuterol, and this is known under the brand names ProAir, Proventil, or Ventolin, and these are SABA inhalers.
How to use a metered dose inhaler without a valved holding chamber. Check the dose counter on the inhaler. Do not use it if it says 0. 0 means the inhaler is empty and needs to be replaced. Prime a brand new inhaler before using it for the first time. This prepares the inhaler for use. Prime the inhaler by shaking the inhaler for 10 seconds and spraying 2 or 4 puffs into the air based on your medicine instructions. Prime again if you have not used this inhaler for 1 to 2 weeks or have dropped it. Priming does not waste doses. To take a dose, shake the inhaler to mix the medicine. Take the cap off the inhaler and make sure it is clean and there is nothing inside of the mouthpiece. Prepare your body by sitting or standing up straight. Breathe out all the way, away from the device. Hold the inhaler with your pointer finger on the top of the inhaler. Tilt your head back slightly. Put the inhaler mouthpiece into your mouth, above your tongue. Close your lips tightly around the mouthpiece. Keep your lips closed around the mouthpiece. Breathe in through your mouth at the same time you press down once on the inhaler. Breathe in deep and steady for 3 to 5 seconds to pull the medicine into your lungs. Remove the inhaler and hold your breath for up to 10 seconds. Breathe out slowly through your mouth. Repeat these steps in 1 minute if using more than one puff. Rinse your mouth with water and spit it out. Replace the cap and store in a cool, dry place. Clean your inhaler according to the package instructions. If you have trouble using the inhaler correctly, ask your pharmacist or doctor for help.
What else should you know about asthma and COPD? It's important to identify and track your triggers so that they can be avoided. You want to make sure you're taking medications consistently and on schedule, especially the controller medications, because they will prevent future symptoms and flare-ups. Using your inhalers correctly is extremely important to make sure medications are working the way they're supposed to. And you should be aware that anxiety and stress can be a trigger for symptoms, but you can also experience anxiety and stress from having asthma and COPD. So it's important to find ways that are helpful for you to distress. It's important to understand that uncontrolled or untreated asthma and COPD can cause life-threatening flare-ups, and this can lead to hospitalization and potentially death. You want to make sure that you're having continuous discussions with your medical doctor to create an individualized action and management plan. And this will describe how you can achieve long-term control and what to do when your symptoms arise. Now we will wrap up and review what we've learned today with some questions and an activity. True or false? Asthma symptoms are caused by inflammation and muscle tightening in the airways. If you answered true, that is correct. As we discussed before, asthma is a chronic disease where there is inflammation and muscle tightening happening that is causing your airways to be sensitive, and triggers will cause symptoms to happen. Which of the following is a trigger and the main cause of COPD? You answered C for smoking. That is correct. 75% of people with COPD have a history of smoking, and the other options on this list can lead to symptoms but not cause the disease. What are the main goals of asthma and COPD management? You answered E for all of the above. You are correct. Being able to meet all of these goals for asthma and COPD can really help improve your quality of life, prevent hospitalizations, and prevent your disease from worsening down the line. Which of the following medications is commonly used in both asthma and COPD? You answered B for short-acting beta-2 agonists, or SABAs. You are correct. They are known as relievers or rescue inhalers that are used as needed for additional relief, and the remaining options on here are all for COPD treatment only. Which of the following is true regarding inhaler technique? If you answered B for seal lips firmly around the mouthpiece, that is correct. We do not want to open our mouths widely and spray because that will not deliver the medication to where it's supposed to work. We want to inhale this deeply in the airways of our lungs. And we don't always shake inhalers before we use them. Some inhalers should not be shaken at all. So please make sure you are reading your package instructions and reaching out to your healthcare professionals like a pharmacist if you need extra assistance. Instead of inhaling deeply before administering the inhaler, you actually want to exhale all the air out of your lungs slowly and completely. Thank you for joining me today to learn about asthma and COPD. If you have any questions, you can ask me or one of the pharmacists before we begin our activity.